Hi, friends. Before this episode starts, I just wanted to make a confession. I really wanted to edit some stuff out of this episode, but decided to keep it all in, so I need to clarify a few points. First, if you are an expert on the vestibular system, you will hear very clearly in this episode that I am not an expert on the vestibular system. I have studied it, but it is not my area of expertise, and I got mixed up as I was speaking about it. And at one point, talked about the semicircular canals instead of the otoliths, and I apologize for that. The vestibular system is complex, guys, so it's really important to see an expert in the vestibular system if you're going to get treatment on it. And fortunately, there are a lot of very capable experts in that field. The other thing I want to clarify is about the high intensity intervals that I mentioned in this conversation. If you want to try doing them, please do them under the supervision of a trained professional. And if you want some more specific instructions on how to do them and why they work so well to help with dysautonomia and brain fog, please listen to episode 37 of this podcast, which I will link in the show notes. In that episode, Dr. Mark Allen from Cognitive FX explains the physiology of concussion and how the specific way of doing the intervals that he developed makes such a profound difference for people with post-concussion syndrome. It's totally worth the listen. Okay, I think I've covered my bases. Enjoy this conversation.
Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com.
Hi, friends. Welcome back to the Concussion Coach podcast. Before I introduce my guest today, I just want to make sure that you know about the free guide that is available on my website. It's the 5 best ways to support your loved one dealing with a concussion. If you have a friend or a family member who is struggling with post-concussion symptoms, or if you're the one struggling and would like your loved one to know more about what you're going through and how they can help, head over to my website, www.theconcussioncoach.com, and download the free guide. So I'm excited to welcome back again my fabulous Uncle Don. He is just the wealth of information, and he has gone and done a whole lot of research and is back again to share more information for us that is going to be really helpful and actionable. So I'm really excited for this conversation. I'm going to do a really quick intro of him in case you missed the other 2 episodes, but we will link those episodes in this one's show notes. Make sure you check them out. And yeah, he's fantastic. So Dr. Don Watenpaugh is a scientist, sleep clinician, data artist, and poet. He earned his PhD in physiology at UC Davis. He is ABSM certified in sleep medicine and directed a large urban sleep clinic for 13 years. And he's an adjunct faculty member in the Department of Physiology and Anatomy at the University of North Texas Health Science Center and in the Department of Biomedical Engineering at University of Texas, Arlington. So, Uncle Don, thank you again for being here. And I'm just going to kind of let you go this time. We have some questions that may come up, but mostly I just want to set you loose and hear all of the goodness that you got to share with us.
Oh gosh, well, thank you again, Bethany, for the opportunity to participate in this podcast. What you're doing for patients and educating them and helping them, I'm just so grateful if I can contribute in any way. So yes, I've enjoyed greatly looking into all this, and we're going to have some fun today. But Bethany, the first thing that I am forced to say to you in this context is you have rocks in your head. Now, what do I mean by that? You literally have rocks in your head. We're going to start off with something we touched on earlier, and that's the vestibular system and its involvement. It's very important involvement in concussion. And a key component of the vestibular system are these tiny little calcium carbonate structures called otoliths that are integrated in a protein matrix inside our inner ear. Now, when our heads get bonked hard, as in a concussion, those otoliths can become dislodged. And that's a bad thing because those rocks in your head, Bethany, are part of how our body tells which way is up and also how we're moving through space. And when those things go bad, well, we have trouble with dizziness and vertigo, similar terms, and disorientation when we walk or move through across the planet. And all of those things increase the risk of falls, which can lead to a second concussion. And a re-injury is one of the worst things, as we've discussed, that can happen to a concussion victim. So there are ways to help recover from this vestibular system damage, and those ways are very important to the recovery from a concussion, especially when it involves these symptoms. And I'm not a neurologist, and let's be clear, I'm not an MD either. We've already talked about this. I can't prescribe a glass of water, but this is why I emphasize the importance of patients seeing specifically a neurologist familiar with concussion if they are suffering, if they've had a concussion or believe they may have, and are having symptoms that suggest they've had a concussion. So that's what I wanted to open with. And then secondarily, that vestibular system pathophysiology can lead to what's called dysautonomia or autonomic nervous system imbalance, which is a whole separate set of problems. And the vestibular pathophysiology isn't the only thing contributing to that dysautonomia, but it's one of the major things because it turns out the vestibular system is connected to how our body regulates its basic functions, autonomic function, heart rate, blood pressure, respiration, da da da. And when those things go wrong, well, it's just not a healthy situation. So
Not
with that
fun. Yeah.
opening, does that trigger any questions you have about, Dad, what have you seen in your patients? Do you have any patient stories about this?
Yeah.
Anything to share with your audience, specifically related to vestibular system involvement, vertigo, dysautonomia, etc.
Yes. Oh my gosh, so many things. But one thing when you were talking about the otoliths, and the otoliths are like you were saying, they let us know where we are in space, like positioned, and they they're in they're oriented in space in different ways to so that when we move in certain directions, certain ones are stimulated, and it just gives us that feedback to know where we are. And so I
Right.
know
Let me explain that just a little bit more.
yeah, please.
They're calcium carbonate, this rock basically inside our head. Yes, rocks in our head. And it's about 3 times more dense than living tissue. So when we move through space, when we have an acceleration, when we just have gravity pulling down on us, these calcium carbonate crystals are pulled on or produce a force greater than the surrounding tissue. And that's their raison d'etre, if you will. That's why we have them in there to help send this signal into the living tissue about, again, which way is up, which way are we going, those types of things. I just wanted to explain more of the basic physiology of the otolith and how
Thank
it's
you.
helping us with that density difference is how that force is transmitted to the sensing tissues that then send that information on to the rest of the brain and central nervous system.
Yes, thank you. And the when we are like it can people can feel it, and I think they're probably not surprised if you're riding in a car and you're going forward and you feel that difference there. But even like elevators, I know sometimes that can be surprising for people that riding in an elevator, that vertical motion can be very symptomatic, produce symptoms for people. So yeah, I have a client who, yeah, elevators particularly are challenging, or even like bending down, like
Very,
going the up and down is challenging for them.
wow, very interesting. Huh.
Yeah. Spinning, moving back and forth. Like there's just it can impact everything. And I think if unless we've experienced it, we probably can only imagine how in like we move all the time. That is like our
Yes.
life. We are moving. And so if movement itself is challenging, I think that just can impact people more than we would realize it if unless we've experienced it ourselves.
Hmm.
So yes. Um
And but there are things that can be done to help with that. There are therapies, there are exercises, and you know, I don't remember what it's called. Dang it, the specific movement where you lean backwards and to the left and up or whatever, whichever direction. But there are movements and things that can be very helpful in helping that vestibular system reintegrate, like get back to how it needs to be. So I just
Yes.
want people to know that that is possible.
Yes, these are simple maneuvers that, again, these are things to be done under the guidance of a neurologist, qualified and experienced with treatment of concussions. And so we don't need to go into those details except to emphasize what you just said, and that is there are relatively simple things to be done here. And the basic strategy, Bethany, is just challenge the system within the person's tolerance limits to re-educate and reset their vestibular system and thus their central nervous system to process the vestibular information, trying to get back to normal. And the way
Mhm.
to get back to normal is to, within appropriate limits, challenge the system and re-educate it. That's the short version of the types of techniques that a neurologist would use to help a patient with that type of problem.
Yeah, and I would also throw out there that it's a lot of times like vestibular specialized physical therapists who are actually doing the most of the therapy things. I think neurologists will usually refer out if I'm understanding how the system works right.
Yes.
So yes,
The
look
neurologist
for.
prescribes, the physical therapist is the one, enacting the therapy.
Mhm.
Exactly right.
Yeah. And I think too well, it's good to be aware that these things are out there and that it can impact things, and it does impact sleep as well. Like the positioning of your body needs to know where it is in space in order to recognize that it's laying down, in order to allow itself to relax to go to sleep. There are really important things for, like, again, that understanding where we are in space makes a big difference for everything. It's one of those foundational things that we don't think about unless there's a problem.
Well, I mean, we've talked about this, I think, on our previous discussions, but I want to reemphasize this phenomenon called benign paroxysmal positional vertigo, BPPV. It's positional vertigo means basically you don't know if you're laying down or standing up. And of course, we sleep laying down. And if you have this, then you have this sensation when you're laying down that you don't really know you're laying down. Now, I'm sitting here trying to describe it. I've never had it. One of my best friends currently is suffering from this for different reasons. I think obviously this can be bad again for the re-injury risk it can cause, which is of all things that makes me question why would they call it benign? Bethany, in someone who's had a concussion, and if there's some factor that's going to increase their risk of a fall and a repeated concussion, there's nothing benign about that.
That's actually
So
very true.
we can't emphasize that enough. Nevertheless, that's the name it's given. But again, it's one of these neurologic conditions that's somewhat common after concussions and it can be treated. And like almost all concussion problems, Bethany, this is one of the take-home messages that we've discussed previously, but I want to emphasize again now, the sooner the better after the
Mhm.
concussion, the sooner you can engage meaningful therapy to recover from whatever symptoms the concussion might be causing for you specifically, then the better the long-term outcome. And that's very important for a few different reasons that we will discuss as we go along today.
Yeah, thank you for saying that. And I just like throwing out there, if people are listening, they're like, I don't even know what kind of therapy to look for. Look for someone who specializes in concussions specifically. Um, Physical therapists, occupational therapists, speech therapists, vision therapists, or neuro-optometrists or ophthalmologists. Um, all of these caregivers can be very, 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 very helpful in the recovery journey. And there are more. But I just wanted to throw those out there just so if people are listening and don't know even where to look, that would be a good starting place,
Mm,
in addition to the neurologist.
yes,
Um,
indeed.
so yeah, thank you for sharing that. And you brought up dysautonomia earlier, and that
Yes.
is something that is just really problematic for people. Can you explain a little bit more about what that is and why it happens after concussion?
Absolutely. The concussion, again, it's a traumatic brain injury, and the brain centers responsible for autonomic function tend to be in the core of the brain and also the brain stem, the hypothalamus, the medulla, those central areas in the brain. It turns out those are very near also the centers, places in the brain that are full of fluid. They're called the ventricles, and there's four of them. And those ventricles are fluid filled. Therefore, with an impact, they have there's a different effects, inertial effects on those ventricles relative to the surrounding tissue. Now that can lead to then what we've talked about again in the previous podcast, disruptions in cerebrospinal fluid circulation, which is critical to brain function and also sleep, as a matter of fact. What we talked about, how sleep is critical for clearing metabolites from the brain that have accumulated during wakefulness. Well, when you disrupt those things, then you can, in those central brain areas, cause inflammation and actual physical damage in some cases that can lead to poor autonomic function. And a term I read about that I hadn't heard before, Bethany, was called an adrenergic storm. Adrenergic means the norepinephrine system, the fight or flight response. Concussion can cause this transient phenomenon called an adrenergic storm that is detrimental to brain function and part of the pathophysiology that leads to dysautonomia.
Hmm.
The early phases of post-concussion are usually hyperactivity of what's called the sympathetic nervous system or the fight or flight response. It's normally something we only activate if there's a problem, that we need to cope with, or some challenge we need to deal with. It's a very appropriate response, for example, when we exercise, especially when we exercise vigorously, the sympathetic nervous system is appropriately highly activated when we're doing hard labor and physical work. And of course, also in emergency situations. But you don't want it just sitting there activated, Bethany, constantly at a baseline state. But a concussion leads to that. That's one of the most fundamental dysautonomic consequences of concussion. The other arm of the sympathetic or of the autonomic nervous system is the parasympathetic nervous system, which is like the counterweight, if you will, to the fight or flight response. It's more about calming and digestive resting functions. And it's overwhelmed in these cases by the hyperadrenergic response, the fight or flight response post-concussion. So that's the short version of post-concussion dysautonomia. This imbalance, this inappropriate imbalance between the sympathetic fight or flight predominance over the resting functions of the parasympathetic system.
Yes, thank you for saying that. And that is, it describes so well what I think everybody listening who has experienced a concussion will be able to relate to, because it is this feeling stuck in that hyper aroused state and being able to come back down and calm the system down is key to healing because when it is in survival mode, it's not in healing mode. And so there are a lot of things and a lot of ways to work on helping that calm down, but it is so key. And I think I just want to throw out there, this is why you mentioned exercise. High intensity interval training can be very helpful for people who are dealing with this, because it's kind of like it trains the brain how to or the nervous system that it can be activated and heightened, and then you stop and you bring it back down and you breathe and you like relax and you kind of, it's like in training the system to know, okay, we can be high and we can come back down, and we want that resilience, we want that change to be possible. So that's, anyway, just wanted to throw that out there, that the HIIT training, high intensity interval training, can be helpful in helping the body learn.
Interesting, Bethany. I hadn't, in the work I've been doing, research for these podcasts, I hadn't seen that specifically, but it makes complete sense. What I have read and seen is that they recommend for post-concussion exercise that you challenge the system, you exercise back to retraining your body. You exercise up to the point where you start to experience symptoms of your concussion, and then you back off.
Mm-hmm.
You push that point, but you don't want to go past it, and you certainly don't want to over challenge it. But you do want to get there.
Mm-hmm.
You want to get to
Yes.
that symptomatic level and then know, okay, that's my limit right now. I shouldn't be pushing any harder than that. But that's part of how exercise helps retrain, yes, our autonomic function after a concussion.
Yes, absolutely. It is so important. And yes, that subthreshold exercise is very key. We want to be exercise like we talked about in the other episodes. I loved your exercise is medicine phrase. I think that is so true. And is very helpful with the concussion recovery as well as the sleep. So let's talk for a second. Well, and in addition, so we mentioned kind of you gave a good general overview of the dysautonomia. I just want to throw out there some of the other things that I've heard people experience who have experienced the dysautonomia piece of concussion. That it's, I mean, it can feel so random, like out of the blue. Like they'll talk about I'm sitting on the couch not doing anything, and all of a sudden my heart rate spikes, or I'm sweating profusely,
Oh,
or
wow.
um, they are. It doesn't seem to be related to anything. It's just
Huh.
and it can be the um POTS like symptoms where
Yes,
you stand up and your blood pressure doesn't go up enough to keep your blood going, and so
right.
you feel really faint or whatever. Like there's a lot of it just impacts again so many ways that you don't necessarily think of, or that you wouldn't even recognize automatically that it was related to the concussion. But it can be very pervasive, the impacts of this.
Mm-hmm.
Um, so, but again, there are things that can be done. There's exercises, there's treatment. So I just want people to know, like, it's real. If you're experiencing these things, it's not just, I mean, it is in your head, but it's not just in your head. It's real. It is actually real. And there are things that can be done to help it. So
Yes, it's in
we'll
your
give it.
head, but it is your head that's sending out the nervous signals to the rest of the body, including the blood vessels,
Yep.
the arterioles all over the body that are part of how we regulate blood pressure and
Yes.
also blood flow during exercise. So when those things are disrupted, right, your body's not operating normally. There's no question about it.
Yep. Yep. Including digestive issues or hormonal issues. There's just so many
Mm-hmm.
things. So, um, yeah, it is important for people to be aware that it can impact everything, like all the systems, because the brain impacts
Yep.
everything. So is there anything that you, in your studies, or anything that you want to share about dysautonomia and sleep specifically?
Well, there are a couple techniques that um, are particularly helpful for helping with that I read about. One is neurofeedback training, and that's something you can do while you're awake. That again with the assistance of a therapist, and it's a non-invasive and drug-free that can help with sleep after a concussion. It turns out, when we sleep, and I think we talked about this before, Bethany, but I'll just recount. The best sleep we can get is called delta sleep or slow wave sleep. And that's where the EEG, the electroencephalogram, has very slow wavelengths, around 0.5 to 1 oscillation per second, very low frequency. And that's great for sleep, but you don't want that during wakefulness. It turns out concussion can lead to delta waves, these slow waves, when you're awake. And this is the nature of what's called brain fog. And it can lead to, of course, poor cognitive function and other deficits after a concussion. You don't want delta waves while you're awake. That's just counterproductive to your wakeful function, and they need to be segregated to sleep. This neurofeedback training is something you do while you're awake that can help reduce this delta rhythm during wakefulness and therefore improve your wakeful function and
Interesting.
help relegate the delta activity to where it should be, which is only during sleep.
Is it, if it's happening during the day, does that mean it's harder to get into at night? I don't know if there's any relation there.
Wow, that's a great question. And I would suspect possibly yes, because again, one of the main functions of delta sleep is to um, rid our brain of metabolites that need to be rinsed out from wakeful function. Well, if you're doing that process while you're awake,
Hmm.
then there's less of a need for it to do, less of a need for your system to do that while you're asleep, which would reduce your sleep drive and contribute to insomnia. Bethany, what an interesting question. I love that question. The connection between inappropriate delta rhythm during wakefulness, post-concussion, and concussion-related insomnia or poor sleep quality.
Hmm.
Wow. Let's
Like,
get you a research grant to study these things, Bethany.
I love you. Thank you. It is, well, it's so interesting. Like all of this is so fascinating. So I love how, yeah, I appreciate your knowledge so that you can answer my questions. And I'm curious too, if they are, it just feels like if people are in that and their brain is working on clearing things out, then it shouldn't be so foggy. But it is like, I guess it's not getting quality, like
Yeah,
concentrated effort at it.
no, the delta waves are not good for cognitive function.
Mhm.
They're good for
Mhm.
sleep.
They're good
It's
for
that
sleep.
simple. During wakefulness, we have theta waves. We can have some alpha rhythm if we're very, very relaxed with our eyes shut. But our brains have high frequency activity while we're awake. None of this slow wave stuff.
Mm. Can you describe what neurofeedback? I'm familiar with it, but can you explain to our audience what neurofeedback would look like or what it is?
Well, I've never experienced it myself, but they uh, use visual and auditory and other inputs uh, to the patient while brain waves are being monitored. And the idea is the slow wave information from the EEG is transmitted to the neurofeedback system. Neurofeedback. You're measuring the neural function and you're feeding the information back to the patient so they can say, hey, my brain is experiencing delta activity right now, and I can consciously be aware of that and try to counteract it, try to suppress it, try to reduce that signal
Mm.
because it's inappropriate during wakefulness. That's how neurofeedback works for all sorts of things, not just this application.
Yeah, yeah, thank you. And it is so cool. It's
Yeah,
possible that we can see it. And again, awareness is the first step to
indeed.
making any change. So, yeah, it's a visual auditory kind of awareness that you can become aware of where your
There's
brain is
two
at. So,
other things prescribed to treat sleep disturbance from concussion, and one of them is transcranial direct current stimulation, TDCS. And this is basically during sleep, helping the brain achieve delta sleep with this transcranial current stimulation. So you can imagine how that works. They're using external electrical inputs that are small enough to be, innocuous. You're not having convulsions during this. It's not like, you know, ECT, electroconvulsive therapy. It's nothing like that.
good.
Not that intense, but it's encouraging the brain to have delta sleep during sleep and therefore facilitating the normal processes of sleep. And then finally, transcranial magnetic stimulation. Your brain, your body tissues have water in them, which makes them an electrical conductor, Bethany. So if you move a magnet across an electrical conductor, what does that do?
It
It produces a current.
magnetizes it. Okay, yeah, I think
This is basic
okay.
physics.
Yes.
You move a magnet uh, near a conductive substance and you generate a current. Well, these transcranial magnetic stimulation has these magnets outside of the skull, outside of the brain, and these magnets can move and therefore, by doing so, generate a current inside the brain. And this is especially useful for treating post-concussion depression and headache, which, by the way, are factors that compromise sleep and sleep quality and the ability to sleep in concussion patients. So
Mhm.
that's how TMS works, transcranial magnetic stimulation.
Fascinating. Thank you. I've heard of the TMS, the transcranial magnetic stimulation. I hadn't heard of the TDCS before, so that's cool. And both
Mhm.
of those, would you, uh, with the TMS, is that something you don't do that while you're sleeping, right? Or is it something like in my mind it's a
No,
clinic you go to, but doing that will help with
no,
sleep?
no, you don't do that while you're sleeping. The transcranial direct current stimulation is done during sleep.
Okay, but not the
Yes.
TMS. Okay.
And then
Um,
finally, there's a technique you've already discussed with a previous podcast guest, and that's the near infrared light uh, transmitted through the skull to the brain tissue.
mhm.
And that's another form of therapy that has been shown to help with recovery from concussions, and specifically with helping sleep.
Yes. Yes, thank you. I think I can link to that in the show notes. There was a episode that I did about a device called the Neuronic, but yeah, there are
Yep.
there's a lot of near infrared light, like red light therapy things that can be very helpful in the recovery. So we can link to that in the show notes. Um, I, when you're talking about this, it reminds me of, and sorry, I'm throwing this at you without talking to you
Yeah.
ahead of time, but um, one of the strategies or apps that I like to encourage people to try is called brainwaves or binaural beats. Are you familiar with those?
I am not.
Okay. It's the way that I understand it, the way it works is you have to use headphones or earbuds or something. You have to have it going in each ear because the what it does is it plays a slightly different, so you've got these brainwave states that you're shooting for or whatever. If you're trying to get to sleep, then delta is what you might want to be going for, right?
Yeah.
Um or if you're very alert and awake and like focused, there's a different state that you're shooting for. What these apps do is it'll play a slightly different frequency within the range that it's shooting for in each ear, and then your thalamus tries to correct that discrepancy, and it brings
Hmm.
the entire brain to um, that state that you're shooting for. I've
What fun.
It's really fascinating, and
Well,
so
that sounds a little bit like the neurofeedback. Well, that is
yes,
neurofeedback training, actually. It's a form of it.
yes, but
And
I think neurofeedback is more active participation, like you are doing it, and this one is kind of more of like it's passive, like you're sitting there and it's just kind of forcing it on you a
oh,
little bit.
how
Um,
interesting.
I've used it the other night actually. I was having trouble going to sleep. I was very awake, like not upset,
Mhm.
not concerned, not like, it wasn't like racing thoughts. I was just like not tired. I had been sick previously and slept a lot, so I think that might have had something to do with it. But I
Oh,
went
okay.
and I put on my Brainwaves app, and within 5 to 10 minutes I was out. It was fantastic. So I've used it on airplanes. Anyway, I'm a believer in it. It is fascinating. So and it's probably a lot cheaper than some of these other therapies, although I think these other therapies are definitely worth looking into if people are having a lot of trouble with sleeping. Um, but
Hmm.
but yeah, I would just throw that out there as another possibility people could look into. Um, yeah, binaural beats, binaural,
I'm
um,
curious now because
brainwaves.
I mean, we're getting sort of deep in the weeds here, Bethany, but two specific forms of biofeedback I didn't talk about were infralow frequency training and alpha training. Both of them related to how biofeedback can be used to help with sleep.
Hmm.
And I think I'm going to look up what you're talking about, but it might be one or both of those because
Huh.
it does exactly what you described that did with the way they're described is what is doing what you described, what you used recently that helped you so much.
Cool. Very cool. Well, thank you. Yes. And I can link to, like I said, there's a lot of apps out there. There's a lot of things that are doing this. You could probably do it on YouTube too, but you do need to have headphones with the Brainwaves one specifically. But I can send you, and I will also put into the show notes um, a link to a couple of um, the apps that I am familiar with that do this. But yeah, I would be interested in hearing what you think
Yeah,
after you look into it some more. So
nice.
thank you.
Bethany, this is an appropriate time for me to jump in with one of my key recommendations, something that I've learned recently in part helping you with your podcast, and that is some keywords to apply to internet searches that can greatly improve the reliability and the trustworthiness of the outcome.
Fantastic. Please
And
share.
this is a nice hack that I am not, as far as I know, I developed it, but I'm sure others use it. And the keywords are scholarly, peer-reviewed research. So I'll give you an example even that I pulled up. So I asked Google the question, what should you do if you think you had a concussion? So those are the exact words. What should you do if you think you had a concussion? And it emphasizes immediately stopping all physical or cognitive activity, such as sports, screens, reading, and seek medical evaluation promptly. And then red flags. It lists several red flags where you should go to an ER, which is great.
Mm-hmm.
And there's nothing wrong with what it said. But then I asked the same question. What does scholarly peer-reviewed research say you should do if you think you had a concussion?
Mm.
And this one, which I love, emphasized the immediate removal from play or high-risk activity, like immediate. And that's a bit a different flavor than what the non-scholarly peer-reviewed text said. Like, you stop now. And then current research highlights a brief 24, 40-hour period of relative rest, physical and cognitive rest, meaning no screens, etc., followed by gradual symptom-guided return to activity, not prolonged rest.
Nice.
And
Okay, yes, that is an important difference. It is
yes,
very important difference.
and it also emphasizes avoid re-injury. We talked about that a lot. Anyway, there are some subtle differences between the guidance when you include the words scholarly peer-reviewed research that are important. Another one is in the non-peer-reviewed text doesn't say anything about avoiding strict cocooning, meaning the peer-reviewed research says do not stay in a dark room. Complete isolation is not beneficial and may hinder recovery. Yes.
Okay, so good.
And then the activity thing, the exercise thing, is emphasized in the scholarly peer-reviewed guidance. So anyway, I encourage people to do their own research on asking the internet questions, either with or without using the terms, what does scholarly peer-reviewed research, or what do scholarly peer-reviewed articles say about this or that? And look at the differences, because there are differences. And I just wanted to share that very important self-help hack for how to get reliable science-based information from the internet.
That's fantastic. Thank you very much. I will, that is really, really good advice. Thank you so much. Yeah, that's excellent. Is there, okay, sorry, I have questions.
Please.
But if you have other things that you're like, I definitely want to make sure that we share this, then
There's one other main topic I wanted to cover with this podcast, but Bethany, let's go. Questions are please.
Okay, well, let me ask this first and maybe it'll lead into I don't know what your other thing is, but is it helpful for people to track their sleep? Because I know that data can be helpful, but I also know that obsessing over sleep and how much you're getting can be problematic too. So I'm very curious to hear your thoughts on that aspect of things.
Oh, no question, it's helpful.
Okay.
Absolutely, yes. A sleep diary, it's called, uh, can be extremely helpful in some cases. I would say it's rarely, if ever, detrimental.
Okay.
I mean, we talked previously about what's called psychophysiologic insomnia, and that's insomnia that's exacerbated by preoccupation with the insomnia itself.
Hmm.
When you are so caught up in your inability to sleep that the anxiety associated with that becomes the reason you're not going to sleep.
Yes.
This is obviously one of those vicious cycles we've talked about, a counterproductive loop that, again, it's hard for a sleep specialist to say to a patient in this case, but you say, just really relax about your sleep. So the preoccupation is counterproductive. Just let's not overemphasize this, because it is, in fact, stirring you up to the point that the problem's getting worse instead of better.
Hmm.
Right. But a sleep diary is unlikely to do that.
Okay.
Information data is almost always good. And in this case, I would, if anybody wants to document what they're up to with their sleep, uh, it's a good thing. It can open their eyes to things like, huh, on days I wasn't able to go to sleep at night, I took a 3 hour nap from 4 to 7 in the afternoon/evening. Hmm, that's a long nap late in the day. I wonder if that contributed to my insomnia that night. The answer, of course, would be yes.
Yes, yes, it did.
That kind of thing. And a sleep diary can reveal all sorts of things like that. Yes. And not, it can be, well, anyway, I'm just a big fan. So the answer is yes. If you have any
Okay.
questions about your sleep or what that sort of thing, it's not going to hurt you to do that.
What are your thoughts on like aura rings or I know like sometimes watches and things you can have wearables that will track your sleep. Um, are those helpful? Do you like those? Is there a
Yeah,
benefit to doing that versus writing it yourself and keeping track of it manually?
there's benefits of both. Um, there's a phenomenon called sleep state misperception, meaning people uh, think they're awake, but they're actually asleep, and vice versa can be the
Mm.
case more rarely. And the objectivity of a device, it's an accelerometer. All it's doing is monitoring movement versus the subjectivity of your own perceptions. Comparing those two can be useful not only for the patient, but if they are having a real sleep problem that they're seeing a clinician about, a sleep doctor, a good sleep doctor is going to want to see those. I
Hmm.
remember back when I was practicing, yes, this was when these things were pretty much, early in their development, but I appreciated the patients who came in with a data log of what their sleep monitor or their Apple Watch or whatever it is might have said about their sleep. I used that information, especially compared to their subjective perceptions of their sleep schedule. Very helpful to a clinician trying to help them with their sleep. Absolutely.
Okay, cool. Thank you. And then I have some questions about kind of tips that you have for structuring the environment to support sleep and I know there's a lot of things out there that um, we can have this conversation. It probably I imagine there will be things that a lot of people have already heard about, like getting to bed at the same time every
Sure.
night, having the sleep hygiene structured. But if there are things that, yeah, like environmentally, air temperature, amount of light, sounds, things like that, and then behaviorally, if there are things that you would recommend people try to do if they're just trying to get themselves to get better sleep, what would you recommend?
Oh gosh, there's a long list. And some of these we have talked about previously, but I'll try to cover some that we haven't. Um, we've talked about what light wavelength and how different light wavelengths activate the system or not. Red wavelengths are our friends at night, like a warm fire or the yellows, oranges, that end of the spectrum, blue, green, etc. Not so much. They can suppress melatonin secretion. So if you have a clock, that has LEDs, you want them to be red.
Mhm.
You don't want them to be green. It's that simple sometimes. Some
Would you
people are so,
recommend
go
Oh,
ahead.
sorry. Would you recommend getting like a lamp that has a red light in it that you use in the evenings?
Yes, and night lights should be red. You
Oh.
can still see fine, but you're not getting a bright white light in your face. It's a very subtle red hue that is unlikely to disrupt your sleep as much.
Hmm. Thank you.
Um, one I think, relatively less known sleep facilitator is something I've become a big fan of, and that's memory foam mattresses
Really?
for people, especially if they sleep with others or sleep with pets. The memory foam mattresses do not transmit movement like a spring mattress or a more conventional mattress.
Hmm.
So if your bed partner or your pets or whatever are doing a lot of flopping around at night or moving, memory foam mattresses isolate you from that.
Hmm.
So I've become a huge fan of memory foam mattresses for that purpose. Hmm.
Cool. Good to know. That is definitely not one that I'd have thought of thought of or heard before. So that, but that
Yeah,
makes sense. Yeah, I like it.
this is a little personal experience. But the only thing wrong with memory foam mattresses is they're heavy as heck and difficult to move.
Hmm.
But as long as you're not moving it around really often, everything should be fine.
Yes. Good. Excellent.
So
What are your
Bethany, there's one, go ahead. You have any more questions?
No, no, go ahead.
Well,
I want to hear it.
one important thing I wanted to cover uh, was in your world and modern concussion popular culture, there's a lot of talk about uh, the youth and sports and all this stuff. There's not nearly as much focus on an at risk group and that's more at risk perhaps than these younger people playing ball and stuff, and that's the elderly. Now,
Hmm.
why would the elderly be at increased risk of concussion? Well, there's a bunch of reasons. First of all, their brains are older, so they're less able to cope with a concussion if they have one. That's just true for their entire body. That includes the brain. Often they are frail or unsteady. They don't walk as easily or as surely as a younger person. They may have cognitive deficits already
Hmm.
to contribute to their fall risk. And that's what we're talking about here mainly is fall risk. Elderly, for a variety of reasons, medications, um, inability to walk as well, unsteadiness are at greater risk of having a fall. And falls notoriously cause concussions in the elderly, which then back to vicious cycles that we've talked about. The more you fall and the more concussions you have, the more likely you are to fall again and have another concussion, which is one of the worst things you can do, as we've talked about many times, especially in the elderly who are less able to recover. It's much more difficult for them to recover from a concussion. And then they're also getting up more at night to go to the bathroom often. And they have a phenomenon called circadian flattening, if you will, where their circadian rhythm is sort of not as healthy as a younger person. They're awake a lot at night, they're asleep a lot during the day, that type of thing. All of those things increase the risk of a fall and therefore a concussion in the elderly who
Hmm.
are less able to recover from it.
I think
So
that
these are
I
things that we're learning more and more about, but aren't getting as much attention in popular culture. And so I wanted to emphasize that here before we close this out.
Yeah, thank you so much. I do feel like this is, I really appreciate you bringing it up because I think exactly what you said. It is not talked about, and for all of those reasons that you mentioned, I can see it being a very big problem. And that was, I mean, in my work as an occupational therapist, I worked in skilled nursing facilities for a long time, and did trainings on falls, like, and like how
Mhm.
people are nervous about falls. That's like a big anxiety producing thing for elderly people a lot of times,
Yes.
and that fear of falling can be problematic as well. But I honestly, as I'm thinking back, I don't think they mentioned concussion as an issue with the falls. They're talking about like broken hips or whatever, but like
No.
the head injury piece is kind of a really big deal. Um,
Absolutely, it is, Bethany. That's what I'm talking about. This isn't out
yes,
there.
yeah, no,
It's
it
in the
isn't.
science. The literature is all over it, but not in popular culture and not in
Mm-mm.
common thoughts and discussions about this in the public.
Yeah. Well, and I think kind of like with teenagers, I mean, if it's elderly on the elderly side, there's changes happening anyway, and it's easy to just chalk up they're more irritable now because they're old, or
Yes,
they're not thinking as clearly because they're old. Like you can just say, and with teenagers, like, oh, they're home, like everything's changing. Like who knows if they're moody because of having this concussion or because they would be moody anyway because they're a teenager, right? It's a similar kind of deal like with the elderly, but there's, the symptomology of it, like the things that they might be dealing with, um, could look like, oh, they're just getting old. They're dealing with these normal
Bethany.
age-related issues. So, I really appreciate you bringing this up. I hope people listening can tune into that with, their loved ones or people that they know. And I think it is going to have to be the people who know them well who are going to be able to notice the changes and maybe have that conversation with them.
Yes.
It's not going to
Back to
be
the
the people, the caregivers who are coming in and out all the time from the home health agency or whatever. Like they're not going to know them well enough. So,
right. And back to the patient advocacy.
yeah.
The importance of that can't be overemphasized in the older population. And
Yeah.
here's a scenario I suspect is fairly common, but maybe not so recognized. An older person's living by themselves, and they want to stay that way. They're happy and comfortable. They don't want to be moved to a facility from their home. They want to continue to live independently. And they have a fall and a concussion. And yes, their loved one who knows them well notices a change in status, but they don't know why. They don't understand it. And the elderly person who fell and had the concussion, their brain isn't working as well as it had been, but they know they don't want to be moved away from their situation. So they're not going to say they had a fall.
Mm,
They're going to be very protective about that type of information because they don't want to be removed from their situation. They're happy
yeah.
and comfortable there, but then again, they had that fall, and there's something going on that their caregiver or their loved one notices. That these are signs to have a closer look and maybe have a frank discussion,
Mm,
or even casually examine the patient's head, that type of thing. To
yeah.
be very attentive to the possibility that that they had a concussion from a fall, and that needs to be attended to.
Thank you so much for bringing that up. Yes, yes. I mean, to everything you just said, like I am confident that that plays out more than we have any idea.
Yes, Bethany.
Yes, absolutely. And brains are brains, and older brains, yes, it might take more, it might be harder for them to heal, but they can still heal. Like I have seen
Yes.
elderly patients heal from or get good progress from treatment even years after the injury. And
Yep.
and if it's a recent injury, then there is hope. So I just hope, and again, people listening, it you want to be aware, you want to know that it happened, or if it happened, or what's like what people are experiencing afterwards, and and please know that there is hope for progress and healing from that. Um, and
Absolutely, yes.
and find people who know concussions specifically.
Right.
That's key. Um, but
And
yeah,
in that
and
age group, by the way, because the treatment protocols and such and the approaches might be importantly different for an older person compared to a child or a young person.
yeah,
And another connection I'd like to make there. Go ahead, Bethany. Go ahead.
oh, I was gonna say, I imagine that the the application of the treatment would be different. Like you're not gonna be having, yeah, it would probably look a little bit different. It's gonna be the similar principles for healing,
Yes.
but it might, yeah, you need a therapist who can adapt their treatments to help the person who, and any good therapist should be able to do that. That's the point, is to be able to
Well,
adapt it
yeah.
to the individual. So,
The use of
yeah,
exercise, for example, would be fundamentally different. Um, for a young athlete compared to an elderly, frail
yes.
person, but nevertheless, it's no less important.
Yep, the
No
exercise
less
itself is
important
important, but
to
the
use the
application of it.
exercise. It's just that you're not going to be getting the older person's heart rate up to 160 on a stationary cycle. After a concussion, that whereas a younger person, that might be an appropriate thing to do.
Yeah, yeah, excellent. Thank you. Okay, what was the other thing you were going to say? Sorry.
Right, both for the young, for anyone, any age with concussion history, that increases the risk of eventually developing dementia or other sort of neurodegenerative disease greatly. And the statistics are quite clear on this. So naturally, if the older person is prone to dementia or already has it, then that makes things that much worse. But the point is, any concussion history increases that risk, and the early and aggressive treatment of the concussion reduces that risk of eventually developing a neurodegenerative disorder like Parkinson's, Alzheimer's, etc. So just wanted to
Yes.
emphasize that. More reason to, if you suspect you've had a concussion or know you've had one, just get medical attention for it as soon as you can. And the sooner the better, and as aggressive as is appropriate for your situation. Elderly, young, all of them.
Yes, thank you so much for bringing that up. And I just, yes, hope people who hear this just take it seriously. We hear like, oh, it's just a concussion in air quotes. Like traditionally in the past we have not taken them seriously. It has been just like, oh yeah, whatever. It's you'll get better. You got knocked on the head. But like, no, really take it seriously. And like you said, it can have very long-term impacts as far as the neurodegenerative stuff down the road. So please do take it seriously. We don't want to like it is again, there's this balance of like we don't want to be like fear mongering like,
Yes,
and
right.
don't do anything because you're afraid of it, but also don't just brush it aside and pretend like it didn't happen. And I think there's a lot of pressure for student athletes and even sometimes parents to have their kids keep going. Like there's a lot of social pressure that has not come around yet. So I think we're working on it. It's improving, but there's a lot that could still be improved. So thank you for bringing that up. I think that's a really important point for people to be aware of. Um, Excellent.
Excellent.
Oh, I from a
Please.
couple conversations ago, I
Yes.
mentioned magnesium. I don't think we ever got the jury was still
Oh,
out. So if
I'm
you
so
want
glad you brought that back up.
to share with us the
Um,
supplements.
right. It turns out that yes, magnesium, um, according to what I looked into, can be helpful. And in fact, specific type of magnesium glycinate,
Hmm.
according to reliable, peer-reviewed, scholarly articles, starting at about 100 milligrams, magnesium glycinate can be helpful for recovering from a concussion. But again, you and I, Bethany, can't prescribe such things. It is a supplement. It's over the counter. But that's something to talk with your caregiver about if you think that might be, if they think that might be helpful to prescribe.
Hmm.
Yes.
Absolutely. Yes, talk to your doctor about it. But yes, that is one that has been brought up a lot in conversations that I've been
It
privy
can
to.
have
So,
gastrointestinal side effects, just FYI.
mhm.
So as with any medication or supplement, you have to weigh the benefits against the the negatives, if you
Yes.
will.
Yeah.
And the side effects are going to be increased, be more problematic at higher doses. Again, this is across all sorts of medications, not just magnesium glycinate.
Yes, thank you. Excellent. All right. Any other tips, things that people should be aware of as they're trying to improve their sleep that we haven't covered or you want to make sure gets
Yeah,
discussed?
two things. Um, when you have a concussion, not that I have experience personally, but you're compromised. Your brain function is compromised. If your job, for example, depends on cognitive function, well, you're not going to be able to do your job as well. It's your air traffic controller, for example, or that type of thing. Um, but that cognitive strain on your brain during recovery from concussion is counterproductive to your recovery. So, a general rule is relax about the rest of your life while you're recovering.
Hmm.
You've got this existence in your job and everything and your obligations, but you need to, for your best long-term outcome, relax about the rest of your life in the moment to protect the rest of your life long term. That's how I would put it.
Hmm.
The rest of your life, acutely recovery phase, you just need to let some of that go. to facilitate your best outcome the rest of your life.
Yes.
Yeah.
Yes. That's so well said. And so, so hard to do. I know, like,
Yeah.
there, people
Easy to
in
say.
so many different situations in life, like, I can't not work or whatever. Like, there's just there,
Yeah.
but you're exactly right. I've talked to so many people too who they pushed and pushed and pushed for so long, and
Yep.
finally were like, you know what, never mind. I'm gonna give this recovery let that be my highest priority. And
Yes.
then they were able to get things. And so yeah, I appreciate you saying that, and I know that it's so hard. It's hard to hear, and it's also hard to grapple with as far as like people don't know, like, am I quote unquote that bad? Like, is it that bad that I need to do that, or can I get by with other things? Like, it's just I just want to throw out there that it's not easy. It's not easy
Well,
to know, but
but
prioritizing the recovery really, really makes a difference.
it reminds me of that study we talked about where the high school students with concussions were monitored in their recovery, and the ones who were trying to recover during the school year had a poorer recovery progress than the ones who were recovering from their concussion during the summer
Hmm.
when they were off of school. Those student concussion patients did significantly better in their recovery than the ones trying to recover during the school year. Bethany, there it is.
Yeah.
This is science.
Yeah.
And then the final thing I wanted to share uh, is that consider being a research subject. If you have had a concussion and you're in a situation where you're aware of a nearby research laboratory or whatever that is doing research on concussions, treatments, outcomes, etc., please consider being a subject. The science you help support will help support future patients in your shoes. So thank you. Science needs people to participate
Mm. How
in
how would
medical
people
science.
find out? Like, if there was something, how would they know like, where would they look to find out if there's
Local
something?
university, especially one with a department, neurology department, or the biomedical science department that's involved in some sort of concussion research. The I can't give you necessarily a repository of where they would find such places, but and it's just like, oh, I had a concussion. Now I need to go find a research department that's working on this. I mean, I'm challenging the system here. I understand that. Nevertheless, I think it's important, and so just wanted to encourage that.
Yeah, thank you. That's again something I hadn't considered or thought about, but I could see that being very, very beneficial for the whole movement here. We're trying to like improve this space in general. So yes,
Yes.
if people are willing and able, or family members can help look it up and find out what's out there.
Right, and you could be part of a treatment protocol that's new and untested, but is being tested by the research that could be very beneficial.
Yeah,
If it's
yeah.
going to get to that phase of research, then the investigators are hypothesizing that it's going to be better than what's currently going on.
Hmm.
So you could help yourself in addition to helping medical science, is my point.
Excellent. Thank you. Yes, yes, I know people get to a point where they're willing to try anything. So,
Yeah.
that is good to know. So, excellent. Thank you. Thank you so much, Uncle Don. This has been just such a pleasure for me to get to hang out with you and pick your brain. And I really, really genuinely appreciate all of the hours of study and research that you've put into prepping for these. And I know that it will be very, very beneficial to a lot of people. So thank you from the bottom of my
Absolutely.
heart. Thank you for all that you've done for this. This is so
Yes.
helpful.
Again, thank you, Bethany, for the honor and opportunity to participate in the Concussion Coach podcast.
Yay. Awesome. All right. Well, thank you. Thank you. Have a wonderful day.
You too.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website, And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.